We're back here at Boom Bust with Colin Craig of secondstreet.org talking about healthcare funding and provision of healthcare in this country. Just pursuant to your last point there, Colin, you did have a commentary recently because you found that the federal government was creating these penalties. They're actually exacting penalties to provincial governments for in cases where provincial governments were allowing the patients to use privately funded, I suppose, clinics. So is that the thing that you're concerned about, that the federal government's going in the wrong direction on this?
Yeah, for sure they're going in the wrong direction. Their decisions, if provincial governments respond the way Ottawa wants, it will lead to longer wait times. So right now in Canada, in about 7 provinces, I believe it is, as an example, if you want an MRI, you have 2 choices. You can wait for the government-run healthcare system to provide it to you, or you can go to a private clinic and pay out of pocket. And so what Ottawa is trying to do is eliminate that option. They don't want patients to be able to pay out of pocket for these services. And so if that happens, then all these patients right now who are deciding to pay out of pocket, well, they're going to have to depend on the public healthcare system, and that's going to lead to an increase in wait times. So I think Ottawa's going in the wrong direction, and they'd be wise to reconsider that decision.
I mean, and this goes to the politics of it perhaps as well, but there's even controversy, like for instance, the Ford government in Ontario saying, look, we're not saying you can pay privately using your Visa card. We're only saying that you can use your OHIP card, but it doesn't have to be at a centrally run hospital facility or other facility. It can be a private facility that has access to the healthcare system through your OHIP card. So no extra cost to you. Even that has been controversial. Have you noticed the same thing?
Well, yeah, it's about, again, it goes back to control. The unions don't want to lose control. So if someone's going to a private clinic to get their knee done and the government is paying for it, that private clinic may not use unionized workers. So the unions don't like that. They don't want to lose all those millions of dollars in union dues. So I think that's what this really boils down to. But for the union, for nurses, it's a good thing because it gives them more choice in terms of where to work. Right, before this announcement, they largely had one choice: do you want to work at the local government hospital, or maybe go and live somewhere else and work somewhere else? Whereas now they might have a choice. Oh, I could maybe get a job at that private clinic, or maybe one of these other private clinics. But if we think about this from the patient perspective, what do patients want when they need, say, knee surgery as an example? I think they'll tell you probably 3 things. They want to make sure that it's done right. Second, they don't want to wait a long time. And third, when they walk out, they don't want to face a big bill.
Right.
And all of those 3 conditions are met when the government says, okay, you can go to this private clinic here and get it done, and we'll pay for it as the government with the funds we raise in taxes and so forth. So, for patients, it's a good thing, I think, to have more choices too. And in some provinces, they've found that it's actually more cost effective to work with these private clinics rather than doing everything in these big bloated government hospitals. So I think the Ford government's on the right track there. I think what they would be wise to do is push back on these bans on private healthcare at the federal level, because it's not a good thing. And I should probably be interviewing you, Tony, because you've sat around, probably the only Canadian who's sat around a provincial cabinet table as a health minister, but also federally as a health minister. So I don't know if you have any insight. I mean, the public opinion is there in support of health reform, but how do we get past this gridlock so that we can do what these countries are doing?
Well, I think let me say this, that I think that the political environment has changed rapidly, particularly with COVID and the pandemic, backing up wait lists because the system was overpowered by COVID. And so consequently, what I've noticed now, Colin, and what you're probably picking up as well, is that there is an appetite for some reform from Canadians. And yes, we get the same arguments, as you mentioned in the first segment, scaring people with this approach that it's going to mean poor health care for you. It means you're going to have to pay out of pocket for your health care, and we don't want that. And those arguments, which were really a powerful force of resistance 20 years ago, now people are saying, I don't see it that way. That isn't what the government is actually saying. And furthermore, we got to change the system. Like people are at the point where they're saying you can't go. This can't go on with the status quo. So I think we're at a point where change is not only necessary but desirable.